Welcome back to the April episode of County Connection. For our final segment, we are going to focus on National Public Health Week, which is April 4th through the 10th. And with me are some of our public health superstars in Summit County. We have Whitney Smith, who is the director of the Women, Infants, and Children program, which is a nutritional program, and more.
Exactly.
And Dan Hendershot, who is the environmental health manager. Welcome, Dan.
Thank you.
All right. So Whitney, why don't you start us off by giving an overview of what National Public Health Week is and why people should care?
Yeah, definitely. So to start, public health is defined as the science of protecting the safety and improving the health of families and communities. And I think all of us at Summit County Public Health would agree that we have pretty amazing jobs in the sense that we are doing just what that definition says and trying to promote health to the families within Summit County to look at the health of us as a community. And every year in the beginning of April, we celebrate National Public Health Week, which is actually a national celebration. There is a website you can visit. It's www.nphw.org. And on that website, it really highlights some of the things that public health does because people don't understand all that we encompass.
Sure.
So 3 years ago, we started creating an annual report that really kind of highlighted how many different components public health has. And you can look for that in the Summit Daily this Public Health Week. And it really capitalizes on some of the national goals and what we do here in Summit County to support them.
Okay. And what are a couple of those goals that I guess really relate to a lot of the major programs that you have going on in Summit County Public Health?
Definitely. Some of the specific goals, one is talking about build a nation of safe, healthy communities that Dan can really speak to where environmental health comes involved. And then another one is just giving everyone a choice for healthy food, which I love talking about food.
Great. So. Me too. I'm glad you're here. All right, Dan. So focusing on that goal for healthy communities and safe, healthy communities. So we know one of the origins of the field of public health was to investigate communicable diseases and to prevent the spread of disease. So can you talk a little bit about that and what that looks like in the modern day context for Summit County?
Yeah, communicable disease prevention is basically just public health getting involved to control the spread of some of these diseases that can be spread from person to person or person to animal to person, environmentally, different things like that, food, water. And so there's a lot of diseases that the docs, when they diagnose them, they have to report them to the health department. And we had 42 of those investigations last year in Summit County.
Wow.
And this is a really fun part of public health because it brings all of us together. We work together, environmental health and communicable disease nursing folks, even nutrition folks, to try to figure out what's the cause and how we prevent these diseases. And we investigated about 28 calls of suspect foodborne illness that we just received from the public. Those are unconfirmed. I ate at this place and this place yesterday, and I think they made me sick, you know?
Sure.
And so our job is twofold. Number one, we're trying to determine what the source of these illnesses were, so that we can stop that source from making others sick.
Sure.
And then if the disease is communicable from that person that's sick to others, we want to make sure that we stop that flow or that propagation of that illness. Sometimes we have to exclude folks from working in restaurants. Sometimes we go into child care centers and we require extra sanitizing and disinfecting. Sometimes we just have to close facilities to make sure that folks don't continue to get sick.
Right. I know that another area that you focus on in terms of keeping people safe and healthy, and also it kind of feeds into this preventing the spread of disease, is water. So water is obviously a huge part of all of our lives, whether we're out enjoying it on the river or drinking a glass of well water or something. So can you talk about what Summit County Public Health does to keep our water safe?
Sure, yeah. We all like to get out on the water. I've seen you out there before, rafting or kayaking, and we have some of the cleanest water around, fortunately. I used to kayak down in Denver. They called it the sewer slalom, but
Yikes.
that's a whole nother story for another day.
Was that
But-
before you became an environmental health
No,
professional?
it wasn't. So we like to manage risk, not totally eliminate
Okay, fair
every
enough.
ounce of risk. So public health and environmental health division specifically, our second biggest program is overseeing on-site wastewater systems.
Okay.
And so people typically think of those as septic systems. So when you think of a septic system, they're a really great way to recycle the wastewater that's generated within a house. You're recycling, you're reusing, those are popular terms these days, of course, because you're taking that water and putting it right back into the groundwater aquifer that you pull your well water from. So it's critical that we maintain this water recycling effort in a good, thorough way. So we have about 3,000 septic systems around the county, and let me see if I can get some of my numbers right here.
And your crew keeps tabs on every single one of those, huh?
Yes, to a certain extent. Certainly with a staff of four of us in the office, we don't give them as much attention as would be ideal, but we are one of the more thorough counties in the state. At every point of sale, a house that has a septic system has to have it inspected. That inspection report comes to us, and 10 to 20% of the time we find failing conditions.
Oh, really?
In fact, last year we had 23 failed septic systems identified, and all of those were corrected so that they're performing optimally again.
And then you're providing some advice and consulting to help folks get compliant.
Yeah, that's right, exactly. We're assisting them along, and sometimes they need financial assistance. Sometimes it's the middle of winter when these things fail, and you can't put in a new septic system in the middle of winter, so we address the public health need of eliminating the hazard by allowing those folks to continue using their house still, and we work with them on that. On a larger scale, we work with the Summit Water Quality Committee, which is a group that is much bigger than septic systems. It's even bigger than the wastewater treatment plant operators in the county. It includes folks like Denver Water and Climax, and we're looking at the bigger picture of water quality and how we can protect that.
So various contaminants and things like that, or?
Yeah, it started off, the Keep Tahoe Blue concept. You get too much nutrients going into the lake, and you get algae blooms, and it's no longer blue and nice, and the fish die. So that was kind of the foundations of the Summit Water Quality Committee, but it's evolved to include things bigger than just nutrients, certainly.
Okay. Great. Well, then one other topic that you sort of alluded to a little bit in terms of the communicable disease investigation and prevention, but you guys keep tabs on what's going on in our restaurants through a really comprehensive inspection program. A friend of mine just got back from Mexico, and he was not feeling so hot. And it seems like you hear those stories more outside of the U.S. than you hear here at home. So, what all does Summit County Public Health do to ensure that our restaurants are safe for visitors and locals alike?
Well, the first contradiction I'm going to have with Whitney here is eating can be hazardous to your health, but it beats the alternative. We all have to eat. But when you think about what you're doing with eating, you're not only taking in all of those nutrients, but you're also taking all the bacteria and viruses that we're surrounded by every day. So it's pretty phenomenal that we don't get sick more often from food. But in the United States, we've got a very rigorous food safety program, and Summit County, we're no different. Let's see, last year we did 648 inspections in retail food establishments. We responded to 57 complaints from the general public on restaurants, and then, as I mentioned, we responded to 28 suspect foodborne illnesses. And what we do when we do those inspections is we go in and look for causes of illness. The first and major cause of illness is dirty hands and lack of hand washing, poor hygiene. And so that's the number one thing we're looking in there followed closely by temperatures. You want to keep your cold foods cold and your hot foods hot, because those bacteria like to grow at the same temperature as our bodies are. So you got to keep it cold and hot. Education is our first approach. We go in and educate. These guys don't want to make people sick. It's bad for business, you know. So they want to keep their food safe. But every once in a while, very small minority, we have to go to enforcement and assess fines. But it's very rare that we have to do that.
And in fact, we have lots of food safety superstars in Summit County.
Restaurants. We do, yeah, we offer the award every year for those folks. And I would really like to encourage people, all of our restaurant inspection results are available on our website. Just the normal county website, and go to public health, and you can find your favorite restaurant there and how they did on their last few inspections.
All right. Well, a fantastic service, keeping us all safe.
Yeah, it's fun.
All right. So let's stick on the healthy eating topic. And so, Whitney, why don't you talk to us about some of the accomplishments from WIC and other programs in public health on the topic of nutrition?
One thing I want to start out with is all of us in public health, we really support this notion that everyone has the right to good health. And I think it was really cool listening to Dan and all of the things that they're doing. We often say environmental health. Environmental health is part of our department as public health.
Right.
And it's so cool to think about all the moving pieces of this kind of puzzle that we have to work together, because when food safety comes into play, we have an entire department of environmental health specialists that can work on these restaurant inspections and how we're giving people in Summit County that right to the good health to eat in establishments that offer safe food. And then when outbreaks do come, it really highlights how much is going on in our department, because you bring in the public health nurses, you have myself as a dietitian, and we have all of these moving parts where if I'm trying to put together a class on healthy snacks, I have somebody in my department that's like, hey Dan, what am I actually allowed to do so that I don't send 10 people home sick?
Right.
So I think it was just kind of cool listening to you talk about how diverse public health is.
Right.
As far as one of the public health goals of giving everyone a choice of healthy food, what I can really speak to personally is the WIC program. We do highlight in our annual report. It's a supplemental nutrition program for women, infant, and children. We had over 300 participants last year.
Wow.
And another thing that Dan said, we're really focusing on that education. What we do as public health is we're not fixing people's health and making everything right for them, but we want to give them the tools that, hey, if this is something that you want to do, you have the right to do it, and here's how you can.
So really an empowerment kind of lesson there.
Definitely. And the same thing in the restaurants, you know, these are the things that we didn't pass. Here's what you can do to make it better. And it's just giving that knowledge and sharing knowledge with everybody. And also with the communicable disease and in the child care centers, one, I think, great accomplishment that shows a partnership between nutrition and the public health and nursing. Our public health and nursing staff goes into all the child cares and does child care consultations. And we've come up with specific things that'll come on the radar, where one of our nurses has done a whole thing on safe sleep, but then the next month something will come up like Johnny's not eating his snacks, like how do we promote best practice in the childcare setting? And again, you can tie in, I'll go in with the childcare, the nurse going to do the consultations and do nutrition education, and again, we bring in all those pieces of public health. So how can we empower different parts of our community to offer the best choices for our community members?
Great. And I know that you even have really strong partnerships with other organizations in county government and even nonprofits in the community as well. I know that the Grow to Share program is a great example of that.
Yes, we talked about Grow to Share on a different episode, and I think that was a huge accomplishment last year between WIC appointments and the FERC Food Bank. We were able to give away over 256 pounds of fresh produce, and that's a lot of lettuce. I've said that before.
Grown right here in Summit County.
Exactly, and it's snowing outside as we speak, and I just went to a community garden meeting last week, and There's plots still available through HC3 if you go onto the Summit Garden Network. We're trying to fill up those plots, and we're also going to have the plots for the Grow to Share program where 100% of that food will be donated to WIC families and the FERC Food Bank.
Excellent. All right, so definitely for those green thumbs out there, go grab your plot. So we know that you guys do a ton of work to keep this community healthy and safe, but you don't have to be a public health professional to contribute to our community's health. So what are some ways that folks out in the community can support public health in Summit County?
Get a garden plot.
There you go. I just have a couple of tips here. Test your well water if you're on a private well. No one is forcing you to make sure that your well water quality is good, so you can have it tested. Get active with your local water district if you are not on a private well, and get involved with the decisions they're making, such as whether to keep fluoridation or not. Review retail food inspection reports. We talked about that, and make decisions that are based on that. Maintain your on-site wastewater or septic system. Clean the filters. Pump the tank. If there's green goo surfacing in your yard, it's probably not a natural spring. We get that.
And is that that's a major symptom?
Probably a failing septic system that should be fixed. And then by far the number one most effective disease control method that we all teach is hand washing. And so you can't emphasize that enough.
Okay, great. Any nutrition tips for us that you want to throw out?
Going back to public health before I dive into food,
sure.
I would just say educate yourself. Look for our annual report that's coming out. We highlight things that have worked in public health for many, many years. Our theme this year is something old, something new. So we really kind of focus on here are things that have worked forever. Like vaccines have been a product of their own success. This is how they've worked. This is how they've evolved. These are the things we offer at public health. Educate yourself. This is what we have available. With food, same exact thing. Education is power. One single thing that people can do is stay away from sugary drinks. When we think about the obesity epidemic that's sweeping our nation, currently 1 out of 3 kids in the US are overweight or obese. Choosing water over a sugar-sweetened beverage, educate yourself. I'm often at health fairs with sugar cubes talking about sugar, and if we can just switch to water, that's a pretty simple thing as well.
All right, great tips. All right, anything else that either of you would like to add about National Public Health Week or any recent accomplishments of Summit County Public Health?
I don't have anything at this point.
All right. Well, you've given a lot, so
Yeah.
I just wanted to make sure that we hit everything that you wanted to cover. All right. So lastly, let folks know how they can get in touch with you if they have questions about the work you do in general or any of the specific programs that you've talked about today.
Yeah, that's a very good question, Julie, because we live in 2 different places. Environmental health is commonly confused because we live down at the county commons with community development division, building department, planning, down by the library.
Okay.
And the rest of public health lives up at the medical office building. And that's just because of who we interact with on a day-to-day basis. Our mission and our goals are common, but our day-to-day work and who we work with is a little different.
Okay.
So we all share the same website. You can easily get to us that way, or you can contact Environmental Health. Our phone number is 668-4070, and Public Health is 668-9161.
Correct.
Yeah.
All right. Great. Well, yeah, so everyone be sure to reach out to Whitney and Dan if you have questions about the work that they do to keep Summit County safe and healthy. And thanks to you guys for all that hard work.
Thank you.
And thanks to those of you at home who have joined us for another episode of County Connection. We will see you next month.